everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are today's reports. Diabetes, a serious risk of heart failure. Improper blood glucose levels, a very common effect of uncontrolled diabetes over a period of time, leads to serious damage to many parts of the body system, especially the nerves and even the blood vessels. Now, the risk of heart failure in association with diabetes mellitus status in patients developing with coronary artery disease over a period of time was brought out by a study in the journal Diabetes and Metabolism. In the study, diabetes was associated with a very constant near twofold increase in the risk of heart failure. So thereby avoiding the risk of heart failure occurrence in coronary artery disease patients with diabetes mellitus is critical in daily practice and should be a constant lifelong endeavor. Infarct size of circulating fibrocyte levels, a risk factor for myocardial infarction. Cardiac attack, the global cause of death worldwide, is caused by several reasons. The ST segment elevation myocardial infarction, which is the STEMI, is the term cardiologists usually use to describe a classic heart attack. The infarct size is a strong predictor of the outcomes after an ST elevation myocardial infarction, and according to a study published in the American Heart Journal, circulating fibrocytes measuring 6 months after an STMI procedure positively correlate with a 6-month infarct size. The fibrocytes have been shown to home the injured myocardium in patients with myocardial infarction, and the concentration of circulating fibrocytes is a serious risk factor that definitely has to be considered. Smoking affects cardiac troponin complex even after cessation. Smokers are more prone to heart diseases than the non-smokers group. Cardiac troponin and the troponin alone are cardiac regulatory proteins that, however, control the calcium-mediated interactions between the actin and the myosin filaments. Now, despite both cardiac troponins and cigarette smoking, they have positive links with the cardiovascular risk. High-sensitivity assays of this particular condition show that concentrations of cardiac troponin 1 are lower in chronic smokers than in the non-smoker groups. In a new study that has been published in the Journal of the American Heart Association, it was shown that the current as well as the past cigarette smoking condition is related to reduced high-sensitivity assays concentrations in the general population. Hence, the study concluded that people should be warned and educated up to this level that they may be able to restrain themselves, thereby even sparing the non-smokers as well. Longer screen time associated with autism spectrum disorder in infants. Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and even communication. The disorder also includes limited and repetitive patterns of behavior. Now, this greatly affects the quality of life in children particularly. An article published in the Journal of the American Medical Association has shown that longer the screen use at 1 year of age was connected with the development of autism spectrum disorder at 3 years of age, and this is mainly confined to male population. Even after controlling the propensity for autism spectrum disorder at 1 year of age and maternal maltreatment variables, the higher the screen time at 1 year of age was related with autism spectrum disorder development at 3 years of age in boys in this particular cohort research. So with the fast growth in the gadget usage and technology getting advanced, it is however vital to assess its health impact on newborns and limit excessive screen time. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.